Computer. Alrighty. So what's due today? This is week 9 of a week 10 series. So what is due today? Task 8, discussion 8, lesson 8, and what's due next week? Task 9, discussion 9, lesson 9 is due next week. And next week, I will be posting, just like your midterm, your final written exam. And of course, after you get your grade and all that, make sure to do your end of course survey that's on topic 10. Today we'll be doing the topics for this week, which is a continuation of homeostasis. And it's going to be a quick lecture. And then right after this quick lecture, I'm going to go over all the chapters that that you like, as a review. So let's start with acid-base, buffering systems, respiratory regulation, and renal regulation. So did I go over pH with you guys? Well, even if I did or didn't, I'm going to go over it again. So let's look at a typical pH scale. And the one I like is this one, I believe it was. Yeah, let's look at this one. So when we're looking at pH, what does pH really mean? pH really means, it's actually a mathematical equation. P with a capital H equals the negative log or the negative logarithm of the concentration of the hydrogen ion. Okay, put this like this. So what does that mean? And then that scale that I just copied. So it's a scale from 1 to 14. And pH measures how much hydrogen ion there is. So if there's a lot of hydrogen ion, which is on the acidic side, so neutral is 7, somewhere in the middle. But if something's acidic, like the closer it is to 1, that's super acid. Let me, let's fix this layout so we can get a bigger view of this. There you go. Okay, let me start writing down here. So when you're looking at this scale, 7 is neutral, and if it's acidic, it's going to have lots of hydrogen ion. So let me insert a shape. It's a good. It's going to have lots of H plus, which is hydrogen ion. So that's what the pH scale really means. So when we're looking at water, it's neutral, it's in the middle. But once you start going down, milk is it's debatable, it's around here. But definitely tomato juice, if I put that, it goes on you, it won't really message you, but even apple juice. But if I put lemon juice in your eye, and if I definitely put gastric acid on your skin, it's going to react. Because if you recall, our first couple of lectures, we talked about how ions are highly reactive. So the closer it gets to 1, the pH scale, so a pH of 1 is gastric acid. 2, 3, that's lemon juice, apple juice. So we need, as human beings, to be in the middle. Now, what's on the opposite side of the spectrum? Now, if that's H plus, a base or an alkaline doesn't have a lot of H pluses. It has a lot of OH minus, which is also another hydrogen ion. And you know that if I put soap on you, there's going to be some reaction, of course. We like soap and hand soaps, and we already had a discussion regarding how hand soaps are, all hand soaps are, in reality, antimicrobial, because a microbe loves neutral pH. just like us human beings love neutral pH because it's a living thing. So what does hand soap do, right? When I wash my hands, what am I doing to a lot of that extra bacteria on my hands that I'm picking up? But I put ammonia, I put bleach, right? I put any of that stuff on my skin, it will react, and it will react rather poorly and rather aggressively. Now, you could also ask, what's in pH 13 and 14? That's, what's a really good chemical? When you, if you have an old school oven and you have that oven cleaner, that's pH 13. I always tell this story. When I was a kid, my mom taught me how to clean, everything actually. And then one day I was in third grade, and for whatever reason, she said, "Go clean the oven. I already showed you how." And she showed me how to put a handkerchief over my face, and then make sure all the windows are open, and even put on a fan, and then spray it, and then close the door, and then get out of that room. Well, 9-year-old Nelson, not so bright, wanted to go play with his friends, so I just sprayed. I didn't do all the protocols. And just like if you don't do all the protocols in the hospital, which are there to protect you, what will happen? The pH 13 OH minus was highly reactive to to my lungs. And what happened? Later on that evening, my mother and my sister caught me passed out on the kitchen floor with the oven cleaner in my hand, and the whole house smelling like oven cleaner. I just remember not going to the hospital. Back in the 70s, especially if your parents were medical personnel, they don't really go to the hospital. Didn't really think it was a priority, I guess. Who knows? So it goes, if you look at OH minus, it's just like saying I have decreased, where's that decreased, my shape? It's just like saying decrease hydrogen ion. So here's a neat thing. If I put OH minus together and H plus together, guess what I get in the middle? H2O. And if you want to look at some Illuminati kind of stuff, what do you think 66% of human beings are made out of? We're made out of water. So therefore, we should be in balance. And that's what we've been talking about. And that's what your body does all day, homeostasis. Homeo meaning the same, stasis means to stand in one place. So your body doesn't like being on either extreme. So how could I ask this question on an exam? I could say, hey, my patient has a pH of 4. Are they acidic, or are they alkali or base? You'll tell me, hey, 4, that's on to the left of this scale. That means they're acidic. I could also ask, their blood will have a lot of H plus, or will have a lot of OH minus? And you'll say H plus. On the other side of the spectrum, my patient has a blood pH of pH 10. Are they acidic, neutral, or basic? And you'll say, hey, they're basic. It's here, it's to the right of the 7. So my patient's basic. I could ask, do they have a lot of hydroxide ion? And you'll say, yup. Do they have a lot of hydrogen ion? And you'll say, nope. And that's a typical acid-based question. Now, let's now get into a little the compensations. Because if you look at the objectives for today, they talked about how does your body keep homeostasis? How does your body keep in the middle? Well, there's 2 compensations. And the first one is metabolic. And metabolic compensation comes in the form of buffers. Now, what's a buffer? A buffer is essentially it's either a weak acid or a weak base. Now, how does that work? And your kidneys play an important part in this as well, because what do the kidneys do? They either keep things or throw away things. So can they keep hydrogen ion or throw away a hydrogen ion if they wish? Yep. So that's what one way, your kidneys, and that's part of your metabolic compensation. And also your kidneys and other things can also release buffers, which is either a weak acid or a weak base. Let's say, for example, I'm a little bit acidic, right? 5 or 6, I'm here. So my body's going to release a weak base. So I'll have way more hydroxide ions. And what's it going to do? That weak base or that buffer is going to go boop, 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 boop. And it's going to bring me back towards the middle. And that's homeostasis. Let's say if I'm basic, my body's going to release a weak acid, and it's going to start doing what? Doot, 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 and bring me back here in the middle. So that is metabolic compensation. So if your kidneys are doing well, if your blood is doing well, your body should keep a neutral pH around 7.4, give or take. But for our purposes, it's 7. Okay, it's here. It's in the middle. So that's metabolic compensation. And one of the things that I always say goes, you want to mess with somebody's pH, you want to kill somebody real easy, just don't pay attention to the pH scale, and don't pay attention to what you put in an IV line. It's very easy to do. It can mess with all of this. So maybe you've heard of some of these, like Ringer's lactate. And lactate is lactic acid. So that's a weak acid. Okay. Lactic acid we'll talk about more even in a minute. And maybe you've heard of sodium bicarbonate. Don't know how to spell. Bicarbonate. And that is a weak base. And isn't that when you hear in movies like, oh, push Ringer's lactate or push sodium bicarb into your patient in an emergency situation, because in emergency situations how's your homeostasis? It's garbage. So depending on trauma or whatever, it could be all the way over here or it could be all the way over here. And either way, I can use chemicals like at Ringer's lactate and sodium bicarbonate to push it. And sodium bicarbonate is an example of a weak base. Ringer's lactate is an example of lactic acid, which is a weak acid. So Ringer's lactate has some H pluses, and sodium bicarb has OH minuses. Okay, so that's metabolic compensation. So I could ask you, what's one way your body maintains pH homeostasis? And you'll tell me, oh, it's metabolic compensation, either the release of a weak acid or a weak base to push me towards the middle, because that's what I want. I want to be in the middle. What is the respiratory compensation? Well, that's breathing. So if my patient doesn't breathe very well, or if my patient has a lower respiratory tract problem, they're also going to have an acid-base problem. Okay? And that's why the Department of Respiratory Medicine, or also known as the Department of Pulmonology, we love doing arterial blood gases, or ABGs. And ABG measures the pH, how many H pluses or H minuses, and it also measures carbon dioxide and oxygen. Now, if you recall, when we talked about respiratory, it is carbon dioxide is the main chemical that your chemoreceptors in your spinal cord, in your cerebrospinal fluid, that's what monitors your breathing. So if you have way too much CO2, it's going to combine with this H plus. And if you have way too much CO2, or if you're retaining carbon dioxide, you're going to want to breathe that out. So one respiratory compensation is if you're acidic, you will have increased breathing or increased respiratory rate. So let's say I'm a little bit acidic. That means I got a lot of H pluses. The H pluses are going to combine with the carbon dioxide. It's going to make carbonic acid. And then guess what's going to happen? I'm going to start breathing a lot faster. And then that's going to push out the H pluses because I'm breathing it out. And then it's going to bring me back to neutral. This is also the reason why many times we put a patient on mechanical ventilation or mech vent, because I can control their breathing. And if they're a little bit acidic, can I increase the respiratory rate on the machine? And it will bring me back to neutral. And of course, if alkaline or basic, another word for basic, then my body's going to decrease breathing or decrease my respiratory rate in order to retain carbonic acid, which combines with carbon dioxide. So you could see how there's a link between carbon dioxide and your pH scale and the relationship with how much oxygen you have. And that is called your arterial blood gas. And those are the three main things that your arterial blood gas can tell us. And many times, for those of you who are future nurses, you will need to be able to interpret that. The doctor will order it, and then the doctor will call you and then ask, is there metabolic compensation or is there respiratory compensation, both or neither? What's the pH of my patient? Are they acidic or are they basic, and is there compensation? Okay, so what kind of question I could ask you? I could ask you, my patient has a pH of 5. What kind of respiratory rate will compensate for it? And you'll tell me increase. And oh, by the way, just as a side note, normal breaths are 12 to 20 breaths per minute. Okay, so anything lower than 12, it's too slow. Anything higher than 20, too fast. So what will happen? My patient will have breathing a little bit on the faster side, 20, 22, that kind of thing, if they're very acidic. If they're very alkaline or basic, then it'll slow down to 12 or a little bit less. Okay? But I won't put 12 to 20. Just for this, I'll just say increase or decrease. And it's one of those questions that'll kill you. You ever have one of those questions? Increase, decrease, both, neither? You guys sit there and rack your brain. How's this? If you have two opposites, memorize one like your life depended on it, and then because your academic life does depend on it, and the other one is simply the other thing, right? For me, H plus is always to the left of this. It's always acidic, and then everything else is what? Basic or OH minus. And if I have an increase on the left, there has to be a decrease on the right. And neutral, water. Okay? All righty. Any questions? You put it in the chat. Now, let's go now to, let's see. We did buffering systems, right? Respiratory regulation, acid base, and here's an acid base tutorial. I wonder if this is active or not. Oh, yeah, this is the thing that I didn't like. Well, it's all right. Right? Now, what's acidosis and alkalosis? Well, we already know, because acidosis is what? pH of anything to the left of the scale. And alkalosis is pH anything to the right of the scale. Now, if you look at this, this is partial pressure of carbon dioxide. And you don't need to know that yet. But you get into your nursing courses, you're going to need to know that. Okay, now what are acid bases? You could sit and memorize this, but I find teaching it this way is confusing. It's better just to look at this and ask yourself, okay, first you always have to ask yourself, is it acidic, neutral, or basic? Once you have that, then you can ask yourself, then what compensations will I have? And what's pathology? Pathology is I'm no longer neutral. I'm staying in either the acidic range or the alkaline range. And or my compensations like metabolic, like let's say if I have kidney problems, that's going to cause metabolic decompensation. If I have any chronic or acute respiratory problem like emphysema, pneumonia, or chronic obstructive pulmonary disease or COPD, I'm going to have a problem with respiratory compensation. Therefore, I'll have a pH problem. Okay? So kidney problem will be a metabolic compensation problem, And a breathing problem would be a respiratory compensation problem, and both of those problems will have pH problems associated with it. So you're going to see charts like this for the rest of your career, but it's just easier to look at it like, you know, in more basic terms, instead of trying to memorize what's metabolic acidosis, what's metabolic alkalosis. So when we looked at our chart, metabolic acidosis is, of course, there's an acid-base problem due to the failure of metabolic compensation, right? And it could be either acidosis or alkalosis. Respiratory acidosis or alkalosis will be any respiratory problem. So I like looking at it like a more simpler way instead of memorizing charts on which one's which. And then for your future pathology, knowing and understanding this, they're going to start having a list of diseases. But again, if they're respiratory diseases, I know if it's a respiratory disease where it increases my respiratory rate, of course, I'm going to have alkalosis. If it decreases my respiratory rate, it's going to have acidosis. And likewise for metabolic, right? If it's too much H+, let's say, for example, my kidneys don't work and it's retaining too much hydrogen ion, I'm going to have metabolic acidosis. Let's say, for example, I'm throwing out too many hydrogen ions because I overdosed on my diuretic medication. I'm going to have metabolic alkalosis. Okay. Metabolic acidosis, the big one in pathology is diabetic ketoacidosis. When a diabetic patient starts decompensating, especially in their kidneys, they love having metabolic acidosis. And metabolic acidosis and ketosis, too many abnormal condition of ketones, that will lead to diabetic ketoacidosis, diabetic coma. That is very, very dangerous. And that's why if a diabetic patient is in the hospital, we love monitoring their pH as well as their sugar. Okay, here's some Carolina notes regarding homeostasis. So you have notes here, which are okay, but you also have these wonderful notes here. I love the Carolina notes because they're simple, and they highlight certain terms, right? And here's the balance, and you can see the balance between hydrogen ion, hydroxide ion, and water. We already showed that. And there's more math. Don't need to know that, but know that when you see brackets around an H+ or around some chemical, that means the concentration of. So pH is the negative logarithm of the concentration of the hydrogen ion. That's what it actually means. Oh, here's another lovely scale that you have in your notes as well. Here, how they go in and out between. I said that hydrogen ion combines with carbon dioxide to form carbonic acid. So that's the carbonic acid buffering system. You also have the phosphate buffering system, and you can see how phosphates connect into H+. That's about it. All right, I'm getting a call, which it sounds like a hacker or whatnot. Okay, so remind me later. Let's now go back to. So we went all of that. We know what pH is. We know acidosis. We know alkalosis. We know acid base, how it buffers, how it compensates, how it constantly corrects itself. Let us now go into a topic that I'm just gonna touch on here, but definitely when you're in your, for those of you who are in nursing, when you are in, they updated it. Because this ABG interpretation, you see this link is dead. Here is a nice video for ABG, and let's, you know what? Let's leave that for for your own edification, because I'd rather get to, and these are nice videos. This one, and I love these ones. These are nice as well. So watch those as well to. What do you call that? To solidify your understanding of what acid base is. But now I'd like to go over all the chapters that you'll be responsible for. And that's what? week 5 on down, and I'm gonna now highlight what is important. Okay, like what's there to look at, and let's see, did I post the practice exam yet? Let me see. Maybe we could show you a little bit about that. Yeah, here. There's practice only. Okay, and I'll show you a little bit of the format of the exam in a minute. But let's go over every, and where do we get the objectives? Because a classic question in my tutoring courses is, I don't know, or a classic comment is, I don't know what to study. Okay, so this is week 5. So if you look at every task, do you see not only has the chapter, but it has this little list, especially if you created a concept map. So this is anatomy and physiology. So the two main things you always have to ask yourself is, do I know the parts and how the parts work together? And if you were in lab, we had a lovely GI review. So right off the bat, what do you need to know? You need to know this picture right here. Let's see, let's look at chapter 24 in the OpenStax textbook. So if I just have the basic idea that I have to know, what do you call that? I have to know parts and what do they do. So if I'm on chapter 24 and it stated all of this stuff, metabolic and nutrition. Well, actually 23 and 24. Let's look at what do you need to know. Something like this, you need to know. Not necessarily the glands, we didn't go over that much, but you need to know the parts. So if I had a picture and I said your food tube that's connected to your oropharynx and your pharynx, right? Oral, pharynx, throat, esophagus, food tube. Need to know your liver, gallbladder, stomach. Where's your spleen? Large intestine versus small intestine, and the end part of your large intestine is your sigmoid colon, and going down into your anus. Okay. Now, need to know, what does each part do? So here's an example. Well, nerve supply is good because I mentioned that. That's your myenteric plexus. And what did we need? Because what did we need to know about the myenteric plexus? Right? The myenteric plexus is not controlled by you. It's only controlled by your brain. So it is all the muscles as well in your GI system are visceral. Okay. What do we also need to know? It's lined with mucus, right? And mucus is not only a wonderful immunologic protector, it is also a nice lubricant for food, feces, and other things to move through the system. So the parts, that's easy. And what is this? I don't want to update. I just want. All right, what's going on? Okay. Now, we already know neural controls. We already know that hormones control, but did we go over hormones a lot? Nah, not really, right? But what did we go over a lot? Let me get to stomach. Structure of the stomach, and if you recall laboratory, we talked about the rugae or the folds. The stomach is essentially a layer of muscles. We talked about how esophageal sphincter and your pyloric sphincter. Sphincters are essentially valves. They open and close things. The stomach has a ton of acid, and we know that acid breaks down not only a lot of the bacteria, but it also helps break down the food. So know your enzymes that break down things. And amylase breaks down carbohydrates, proteinase breaks down proteins, lipase breaks down fats. And those are the three basic things that are in your food. There's a list of hormones, nice to know, but I didn't lecture too much on this stuff. This is nice to know. May or may not come out, but definitely what will come out is the parts. Definitely come out. I could ask about the stomach. Definitely will come out. I will ask about what's the function of the mucosal barrier in the stomach. It's to keep that pH 1, not lactic acid, the pH hydrochloric acid in my stomach where it belongs. Because if I have erosion of that mucosal barrier, we're going to have some problems. Small and large intestine. The big takeaway regarding small and large intestine is large intestine, I want you to think water. Small intestine, I want you to think nutrients. So large intestine, it's water reabsorption. Small intestine is nutrients reabsorption. And then the secondary function of your large intestines is for the creation of feces. And feces, right, is anything extra, things that the body does not need. Accessory organs. What do you need to know about the liver? If you recall my lecture, the liver is your largest metabolic, metabolic organ in your body. So it breaks down things. Meta, change, bol for growth. So anything you eat and swallow, it has to go through the liver. And gallbladder has your bile, which breaks down fat. Pancreas, we already know, insulin and glucagon. So if you've eaten a big meal, it'll release insulin so that sugar can go inside the cell where it belongs. And if you're haven't eaten or are reaching towards a starvation state, glucagon gets released by the pancreas, and that that mobilizes sugar from your fat. And that's why diabetics, pancreas is a big importance and a big deal, okay, because it's not working. And definitely if you have pancreatic cancer, don't make any plans, you're not going anywhere. Actually, the prognosis is very, very poor for pancreatic CA. It's anywhere from 3 to 6 months. Me personally, I've only had like a half a dozen pancreatic carcinoma patients. All of them died within 4 months. And this is just another view of your alimentary canal. And look, this is a lovely picture. Do you see how it breaks down mechanical and chemical digestion? And doesn't that look like a both A and B? And what is the chemical digestion? It's enzymes. We already talked about enzymes. Proteinase, lipase, amylase. Those are the three main ones. Amylase up here in your saliva, proteinase and lipase is here on the rest of the alimentary canal, also known as your GI tract. So that is your week 5 GI stuff. If you know that, you should be fine for week 5 GI. Let's look at week 6. And do you see what I'm doing? I'm not reading. At this point, exams next week. You shouldn't be reading. You should be culminating all your knowledge. So week 6 is cardiovascular, and as per the lab, know the difference between arteries and veins. Remember we talked about arteries and veins? One is going away from the heart, one is going towards the heart. One has a lot of valves, which is your vein, and one is high pressure and one is low pressure, and that's so know the difference. And what's a big thing regarding the heart? Know the diagrams. I think I put them up in your announcements. So let's look at here. Do you notice I wrote cardiovascular and I wrote more cardiovascular? I have some cardiovascular notes that I put in. Okay. So it outlines all the things you know that we talked about. But this is all well and good, but what's better? And also here, the difference between arteries and veins. Now, if you're in a pinch between cardiovascular and talking about this blood stuff, hit the cardiovascular first. That's more, that has more higher yield. Let me get rid of this. You, of course, have my box diagram. Now, I'm not going to ask you to draw a box diagram, but you could see this diagram, how helpful it is regarding figuring out the anatomy and physiology. So when you're looking at the heart, where's your left side? It's this side. Where's your right side? It's this side when you're looking at a diagram. And if you see my diagram here, this side's red. That means it's oxygenated. So if your exam is in color, so if you see something that's red, it's oxygenated. If you see something that's blue, it's deoxygenated. This side here, the left side, is your systemic side, written right here. This side here goes to your lungs. That means this has to be the pulmonary side. Know your valves. The valve on the left side is your bicuspid or mitral. Notice I only draw 2 doors here. The valve on the right, between your right atrium and right ventricle, these are your AV valves, right? Left atrium, left ventricle. That's your tricuspid. Notice I drew 1, 2, 3 lines here. That's your tricuspid. Then you have your pulmonary valves here. One's going into the aorta, so that has to be the aortic semilunar valve. So the aortic semilunar valve has to be on the left side of my patient. Pulmonary or pulmonic semilunar valve has to be on the right side of my patient. Right-sided problems is also known as cor pulmonale or right-sided heart failure. And if you have any problems here with your hypertension, what's that going to do? If I have hypertension in my systemic circulation, it's going to back up stuff here. Now, where is this important? Well, it's crazy important when we look at, let me just pick any heart diagram at random. This is a classic one. How easy is it for me to go in your textbook and take this diagram, erase all this, and A, B, C, D, E, F, G. Hint, hint, there's going to be at least one picture of this or a picture like this, right? So this is a lovely picture utilizing the box diagram. So if I see here, do you see here everything to the left side of my patient? So this has to be the left. And it's what? Red. It's oxygenated. This has to be the right of my patient because it's deoxygenated. You could see you have a room up here, right? On the right side, right atrium. Right atrium, right ventricle. This has to be the tricuspid. You have your left atrium, left ventricle. This has to be the mitral valve. Right? Another thing that's really nice about the internal structures of the heart, and if you were in lab, if you recall this, remember these? These are the chordae tendineae connected to your papillary muscles, and these are the leaflets of your AV valve. Again, on the right side of the heart, this is the tricuspid. On the left side of the heart, this is called the bicuspid. And I'll try to use a picture like that actually gives it away. Let's see. Oh, yeah. See this, like a picture like this? This will give it away. 1, 2, 3, tricuspid. Right? So, I won't give you a diagram like this. I'll give you it in color. And I'll even leave some of the labels on to give a little bit of a hint. But you know what? You guys are big girls and boys. You should be able to deal with that. So the heart is a big, big topic. And the big thing for cardiovascular, since we also had a lab using that big heart, that should have, what do you call that? That should be a high yield topic. So definitely look at that. Let's look at week 7. Now, what was 7? Respiratory. So again, know your anatomy of your respiratory. Any of the diagrams that we looked at, know the difference between upper respiratory and lower respiratory. Let's look at real quick. Table of contents. When in doubt, always hit the back button. What chapter was it? That's cardiovascular. Here, respiratory. So, see a picture. Know the difference between the upper respiratory and the lower respiratory. Know the beginning of the lower respiratory is your trachea. Know, be able to point out what's the anatomy, where the pharynx or your throat is, where the nasal cavities, the turbinates, the oropharynx, which is the, remember in lab, we looked at the area with the hard palate. That's your oropharynx. Here's a nice little, now I won't do this to you, this is, but I'll just point in like in major sections. Know about goblet cells, because mucus is a big thing, and cilia is a big thing regarding the immune structures of the epithelial lining of your respiratory tract. Epiglottis, remember? We actually saw this when we cut it out of the pig. Vocal folds, nice to know. This, great to know. Carina. And you could see that the tracheal cartilage starts to disappear the deeper you go into the lungs. So here's your larynx, which is also made out of cartilage. Your trachea, or your windpipe, is C-shaped cartilage, only on the front. And then you have your carina, your right main stem bronchus, left main stem bronchus. Know the difference between the two. The right is shorter and more vertical. That means foreign body will fall into the right lung easier than the left. Know what cartilage gives way to smooth muscle. And remember, smooth muscle or visceral muscle, you cannot control. That's why when asthmatic starts getting an asthmatic attack, telling an asthmatic just to calm down, I love that in movies. Oh, just calm down. Yeah, that's going to work, right? Alveoli, big thing in alveoli is that is the area of gas exchange where the capillaries meet. The capillaries are the small vessels in between here, the arteries, and the veins. That's what's big about the alveoli. And you could see they're only single cell thick. Let's see if I can see how small, right? So you could imagine if that's all filled with mucus, if that's all filled with water, that's never a good thing. Just as a side note, because this appears on a lot of exams, type 2 alveolar cells produce pulmonary surfactant. The function of surfactant is to increase surface tension so that your alveoli stay patent. They keep the alveoli open. Okay. Also know how to breathe, right? What muscles do we use when we breathe? Right? That's also important. Remember I drew on the lecture atmospheric pressure versus internal pressure. So that's respiratory gas exchange. And remember, oxygen we need for fuel to eventually make ATP. Carbon dioxide is the byproduct of all of our cells using up that fuel, and that's like, that has to be expelled during expiration. And yeah, look at this video because it'll remind you how important oxygen and glucose is. Without oxygen and glucose, we don't have ATP. No ATP, no fuel, can't move. Don't go anywhere. All right, so that's week 7. Now we're at week 8, which was last week. And do you see what I'm doing? I'm only hitting up what's the most important things of each section. Now in homeostasis 1, which was last week's lecture, the big ticket item is this picture right here. So I'm going to show it to you and explain. And also, diagram. Where is it? Here is the classic homeostasis diagram. Let's copy image. Where's my Microsoft? There it is. So when we're looking at this picture, here are the parts. You have an ascending tract or ascending set of nerves. The control center is always your brain, and you have a descending set of nerves, right? And nerves is send a signal. Now, everything has to start with some sort of imbalance or stimulus. It's going to trip a sensor, right? And you'll learn, it goes, that will signal a message to your brain that, hey, something is up. And your brain will send a message to an effector that will change something. So apply this to, they always apply it to blood pressure and what do you call that? Temperature control. So for example, you feel cold, what happens? You have an ascending tract, also known as an affector, A-F-F-E-C-T-O-R, and it's going to tell your brain, hey, you're cold. What's your brain going to do? It's going to send a motor signal. So this is a sensory side. This is the motor side. It's going to send a motor signal. What's going to happen? You're going to start to shiver. You're going to motor. You're going to get up and put on a jacket or put on a hat. And then it'll bring you back to homeostasis. Same thing with blood pressure. You have chemoreceptors, which detect chemicals like sodium. You got too much sodium, it'll tell your control center, hey, there's too much sodium. Then it'll send a message to an effector, your kidneys. Hey, kidneys, I have too many sodium, throw it out, right? That's chemical. Same thing we talked about just minutes ago. Hey, I have a chemoreceptor imbalance, right? That's going to be my stimulus. The chemoreceptor is the sensor. It's going to tell my brain, you have too many hydrogen ions, right? You're acidic. So what's it going to do? It's going to send out two effectors, one for buffer, which is the metabolic response, and one for your respiratory, which is the respiratory response. And then that will do what? Put everything back to homeostasis. Okay? So when you're looking at last week's lecture, that's the best way to look at everything. This diagram, and it's also on the videos that are on Moodle, and I believe it definitely should be on my lecture because it's the only way, it's like the best way to talk about it. And you could read everything, it makes me dizzy. The best, most people are visual learners, so know this vision. So the control center is always the brain. The receptor side is always the afferent or ascending tract of nerves. The effector side is always the motor descending tracts, okay? So motor, that means what? Something that you can control, and or definitely something that the control center or your brain can control, okay? So if you have a problem with the ascending tract, it's going to be a problem with homeostasis. You got a problem with your brain, problem with homeostasis. Problem with the signal going down to your muscles, right? Problem with homeostasis. And that's essentially what pathology is. Your body no longer can maintain homeostasis. That's all that it means. All right. So now that is all we got for all the weeks. So let's say, and of course this week is homeostasis 2. So that's weeks 5, 6, 7, 8, and 9. That is all the topics for your final exam. Your final exam will be next Wednesday. The exam will be posted here in announcements at around 8:50, 8:55. You'll have until 10:15 a.m. to finish the exam. How are you to finish the exam? Once you open up a Microsoft Word document, you put all I need is answers 1 through 50 in a simple email. Don't take pictures of your exam, or don't send me the questionnaire. I just need, it goes, an email with your name, numbered 1 through 50, with 50 matching letters. And please check your answers. I have 2 F grades from last night. And if I didn't re-look at it, both students shifted the answers 1. And I was like, how can this student get numbers 20 through 50 wrong? And then when I really analyzed it, they shifted the answers. Now, I could be a stickler and then, oh, that's an F grade. But please, 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 because you have other professors, especially those of you who are planning to go to nursing, and there are no makeups on this, okay? And let's look at this also in perspective. If you've been doing work this whole entire time, there's no way a single exam can bring you down, because this exam is only 10%. But if you have not been doing things consistently the entire last 8 weeks, well, you pay to play, all right? And just as another public service announcement for nurse candidates, you have to score a B- or better, or this course doesn't count when you apply to the School of Nursing. All righty? Okay, that's all I got. I'm gonna